This is Heart Rhythm TV. My name is Janet Han, and I'm so lucky to welcome Priya Abani, who is the CEO of AliveCor, here with me today at HRX 2022. So welcome.
Thank you, Janet. Thank you. Hi, everybody.
Of course. So I'm so lucky to get to chat with not just any CEO, but a woman CEO. We don't often get to do that, and a woman CEO who's in sort of the medical space. So AliveCor has just been so outstanding throughout the pandemic. You guys have had a lot of firsts, right? A lot of firsts during the pandemic, which is astounding. You guys were able to get QT emergency use authorization. You have QT monitoring like rolled right into an FDA clearance, which is great for us as clinicians. And then you also have done some stuff on EHR integration, right? So tell me a little bit about how the pandemic was for you guys and what sort of things you've done.
Yeah. Thank you. So the pandemic was, of course, difficult. Especially to run a company. I just joined as CEO, and within 8 months of that, the pandemic started or hit us. So we have several firsts that the company went through. We had the world's first single lead ECG device. Yep. We had the world's first 6-lead FDA cleared device for ECG. And one of the things that happened during the pandemic is we realized that because we have a 6-lead device, we have the ability to measure determinations that were never been done before from the consumer side. Yep. And that is when the QTC element came. We were sitting on an AI, which we had to dust off the shelves and bring it back to life, and then do all the, run all the right neural networks and actually put it for submission. And we were the first device that got cleared, first for emergency authorization of QTC determination using a consumer device just for COVID patients, and then we expanded it for all use cases across all patient categories. And we're very, very thankful that this technology has been, accepted very well in the physician community and in the biopharma community, and we're discovering new usage models for this literally on an everyday basis.
Yeah, I think that was something that we were actually starving for, especially during COVID, right? Yeah. When we as electrophysiologists, we have so many antiarrhythmic drugs that we needed to monitor patients, and we really couldn't do that reliably without having the patient come in. Yeah. And so I think that was a great finding for us, a boon for us for sure. Yeah. And then tell me a little bit about EHR integration. This is like a theme that has been going through HRX quite a bit in the past day and a little quarter now. We're very worried, right? Because there's 100,000 million pieces of data that are coming at us from consumer devices. Yeah. And so how do we get that to come to us and be sort of organized? What have you guys come with?
Yeah, so it's obvious to us that we cannot remain as a parallel universe to what is happening to patients in the hospital. So if we are patient-centric and we are customer-centric, customer-obsessed rather, we have to make sure that the data that they're creating or generating from their, when the 99% of the time when they're not in the hospital, there is an ability to send it back to the physicians whenever it is necessary, right? But also give the right actions to the customers on what to do with the data when they are generating it on the moment. So somebody finds out that they have AFib, what are the choices that they have at that moment? And we want to be the company that, basically provides them with all those actions. So we have done, obviously, integrations with Epic. We have also recently announced our integration into the GE Muse management system, right? Because that is the system that's being used in 87% of large U.S. hospitals. So it's an automatic, journey of the data when the patient takes it at their home, but now it's connected directly to the physician's, basically dashboard, where they can go and look at the ECGs in the same manner as they would look at an ECG in the hospital. And then obviously on top of that, all the actions is, do you want to send the ECG that you're taking to a cardiologist for a review? Do you actually want to talk to a cardiologist? Do you want to share it with your family members? These are all the things that we had to think about, especially during the pandemic, where people are not in a position to go to the hospital in many cases.
Absolutely. I think that piece about being able to sit at my desk,
Yes.
and as I'm reading the thousands of EKGs from the hospital, that,
Yes.
that a cardiac EKG can come up as well, so that we can take care of my patients who live 300 miles away, right?
Yes.
They don't have to come in, so I think that's outstanding. And then the other thing I kind of wanted to also touch on is, what did you sort of learn in the pandemic as a leader? I think it's so hard to lead as it is, right? And being a woman leader, probably even harder. So what did you learn, and what sort of pearls can you give for any woman leader or any leader in general?
Yeah, I wish there were polls to give. Yeah. That would be wonderful. So our mission is to be the 24/7 cardiologist. Mm-hmm. And I think as long as companies, leaders, women leaders, all of us define what our mission is and a vision on how to get the teams from point A to point B, I think it's great. But now what happens is you throw in the pandemic in the mix, mm-hmm. and the path that we had originally charted for us is no longer valid, yeah. although the mission is still very intact. So we had to be very flexible and agile and actually listen to what the customers really need. And if we had not done that, we would have never come up with something like a QTC clearance. Absolutely. Because the company was working on it before, but we just thought, this is probably not the right time. We were looking at other priorities, and we realized that this technology is actually going to be so useful during this time, so we had to bring it back. So I think, having a very clear mission and vision for the company and all of the employees, but then being a little bit flexible in the paths that we take to get there is probably the biggest advice I would give.
I think that is useful for any sort of leadership position, from very first beginning to someone who's been in the business for a long, long time. So I want to thank you so much. This was so outstanding. I could talk to you for hours. So thanks again for coming on the show today, and thanks for coming to HRX 2022. I hope to see you next year in Seattle for sure.
For sure.
So thanks again for everyone watching. Again, HRX 2022, bringing you everything live here from San Diego.